Hello everyone and welcome to Module 7, where we're going to look at geography and the built environment and health. Your learning objectives for this module is going to be to review how geography, health geography, and the built environment influences population health. We're also going to have you search some environmental data and associated health issues. Geography is a study of how the world differs from place to place. It looks at what, where, and why phenomena occur. In population health, we can use geographic tools to examine where diseases are found, how diseases are related to the environment, and where people go to seek health care. Plotting diseases on a map is not anything new. It has been done by hand as far back as the ancient Greeks, and the most famous person to do this was probably Dr. John Snow, when he used hand-drawn maps to show the locations of cholera deaths in the 1850s. Today, this is much easier with the use of computers. One example of this is the Geographic Information System, or GIS. This is a computer system consisting of hardware and software used to store, manipulate, analyze, model, and display spatial and non-spatial data. It lets us visualize, question, analyze, and interpret data to understand relationships, patterns, and trends. And it also allows us to find clusters. Here's an example of how GIS has been used to map heart disease death rates in the United States. The map shows the concentration of heart disease death rates by county, and we can see that they're located primarily in Mississippi, Oklahoma, Louisiana, and Arkansas. This gives healthcare professionals a tool to find clusters and then try to figure out why this is, and then go ahead and design an intervention to improve the health of the specific population. For health geography, I want to refer you back to one of the articles you were assigned for Module 2. This was called Health Geography, Supporting Public Health Policy and Planning by Trevor Dummer. Here he talks about how geography in general, this is where we are born, live, study, and work, directly influences our health experiences. We're talking about the air we breathe, the food we eat, and the viruses we're exposed to, and also the health services that we can access. In health geography, on the other hand, we focus on the interaction between people and the environment, and it is often used to influence health policy. Remember, epidemiology is predicated on the biomedical model and really focuses on biology of disease, while health geography, on the other hand, seeks to explore the social, cultural, and political context for health within a framework of spatial organization. It is a little bit more holistic in that way. Traditionally, research in health geography spans two distinct avenues: the patterns, causes, and spreads of diseases, but also the planning and provision of health services, which is where us as population health professionals really can step in. Now, the built environment includes all the buildings, spaces, and objects that are created or modified by people, and we all know that it has a very large impact on both physical, mental, and social health. This was most obvious when infectious diseases were the primary public health threat, especially during the Industrial Revolution. During this time, unsanitary conditions and overcrowding in urban areas facilitated the spread of infection. Today, not infectious diseases, but chronic diseases are the primary public health problem. We all know that physical spaces can expose people to toxins or pollutants, and it can also influence lifestyles that contribute to diabetes, coronary vascular disease, and asthma. There is good evidence to indicate that the burden of chronic disease in the population can be reduced through an active lifestyle, proper nutrition, and reduced exposure to toxic conditions. This is really where public health advocates can help shape the design of cities and suburbs in ways that improve population health. We're talking about bike paths and walking paths, access to grocery stores. To give you an example of research aligned with this mission is if you go to the website of the University of Western Australia. They really research the relationship between urban planning, community design, and health. They look at the impact of physical, mental, and social health outcomes across all age groups. Some of the research that they have done is they have looked at physical activity interventions targeting dog owners. They have looked at public open spaces. And they also point out that very little is known about the variability of relationships for different population subgroups and how different aspects of the environment might influence different groups differently across the life course. So, as you go through your readings, we want you to think about how differently persons respond to the same interventions. We all know that there are individual differences in responses to health. For example, you can improve walkability in a neighborhood, but if it's not safe, women will not venture outside. And it's also important to not generalize to all populations. Please make sure that you pay attention to gender and sex differences when it comes to health and interventions. In your readings, you're going to be reading about a Healthy Communities initiative. This was a community partnership that promoted active living in Buffalo, New York. And its goal was really to develop and maintain an effective partnership that would promote physical activity, increase community awareness of the benefits of active living, increase access to opportunities for physical activity, enhance policy and organizational supports, and improve the built and natural environments to support active living in the campus and its surrounding neighborhoods. So to do this, they really focused on 5 different strategies. They looked at preparation, promotion, programs, policy, and physical projects. For your discussion for this module, we want you to go to the CDC's National Environmental Public Health Tracking System. The web link is included right here. Go ahead and click on Environments. Choose one of the 7 topics, review the topic, and then click Search Data. To search your data, go ahead and select your mode, select your content, choose geography and time. The geography can either be at a county level or state level. You can choose something for advanced options, so you can leave it back and then just run your query. So what you end up with is an example of a map. The one here depicts lead poisoning based on number of children tested with confirmed blood lead levels of 10 micrograms or higher. So when I look at this map, the first thing that strikes me is that there are many states with no reports of lead levels. If there is no data, how can we address the issue? So next I look at where the clusters are located, and I start to think about what environmental exposures might be located in these areas that put children at risk of lead poisoning. Is it lead pipes? Is it lead paint? Is it pollution? So for your discussion, go ahead and give a brief summary of the results of your query. Before you write it up, make sure you review the section that talks about these data. This is so that you know how to interpret the data. If no current data exists, speculate a little bit about why you think this is. And then go ahead and give 2 examples of community-level interventions that could be applied to improve the health problem. And please do not include an intervention that includes educating the patient, and this is more of an individual level intervention, more than a community level. So thank you.